So good afternoon everyone. So let's start today's class, which is on your spotters from 4th semester. So as has been already told you in yesterday's class, these are some of the representative spotters and related questions. In exams you may get similar questions, same questions, or questions with some modifications. So just pay attention to the pattern and the kind of questions which are being shown today. Similar questions you may get in your exam also. These can be asked in the form of your this morning exercise or in the spotters. Mainly such questions are asked in your spotters, but the theory part which is being asked in such spotter questions can be asked in your viva also or in your short exercise questions also. So we'll start with the spotters. 4th semester mainly covered CNS, autocoids and GIT and endocrine system. So let's see some of the spotters from central nervous system. So like in this slide you have been shown vials of morphine sulfate injection, and the question being asked are which class of analgesic does this drug belongs to. So morphine, you all know it belongs to opioids. Okay, now since these spotters, these are used for assessment as an objective tool, so there are specific answer to all the questions, and if you answer what is expected from that question, you will get full marks, and if you deviate from that, you may not get partial marking also for that answer. So like in this, if you answer it's a central analgesic, which is partially true, but here it is expected that you write the class of these analgesics, so you are expected to write opioid analgesics, okay, which is the correct answer. So these spotters are really very you can score very good marks from these spotters, but just pay attention to what is being asked in the question and answer accordingly. You need not to write elaborate answers for all the questions. Just answer, pinpoint what is being asked from the question. So here the class of analgesic morphine, it is opioid analgesic. Write the specific antidote in case of acute poisoning with this drug. Okay, now again it is very easy to answer, but some of you may write naltrexone, nalmefene. Here the question specifically asks specific antidote in case of acute poisoning. Now for acute poisoning, naloxone is the antidote which is used for acute poisoning with morphine. Okay, it is given by intravenous route and it is used for acute poisoning with morphine. So here naloxone is the answer which is expected from you, not naltrexone, nalmefene or any other opioid antagonist. Okay, so similar questions are asked from all the topics. Another similar question which is made in the form of a case. This case based questions can be asked in your exercise which is given to you to answer in 5 minutes duration. So the question is a 21-year-old male known drug abuser who was brought to the casualty in comatose state. He was hypoventilating and had myotic pupils. His bowel sounds were also reduced. Now again, since today you already know you are we are discussing questions and concepts related to central nervous system, but as such, if you see such a questions, many of you may jump to conclusion that since the patient has myotic pupil, he may myotic pupils are also present with organophosphate poisoning. So read the questions carefully. Here the patient is a drug abuser, okay, and he is hypoventilating as well as his bowel sounds are reduced. Now with organophosphates being a Organophosphate being a cholinesterase inhibitor, they increase acetylcholine and they increase bowel motility. Okay, so absence of bowel sounds indicates it belongs to something other than organophosphates. Now, meiotic pupils, for all practical purposes, you must remember meiotic pupils, the two most important differentials are organophosphates or opioids. Okay, so since the patient is presenting with reduced bowel sounds, so organophosphates are ruled out. Meiotic pupils, hypoventilating, drug abuser, clearly indicates it's a case of opioid poisoning. So identify the type of poison. Again, it's an opioid. What is its specific antidote? Now here you can write any of naloxone, naltrexone, nalbuphine, all are opioid antagonists, but as such most correct answer from these also from these will be naloxone only, because for use as an antidote will use only naloxone. Okay, so here again the type of poison opioid, specific antidote naloxone. Okay, you answer this much, you get full marks for the question. Okay. Now try to focus on this image. Maybe you may see it as somewhat blurred, but this shows a presynaptic neuromuscular junction or neuronal junction, nerve junction. Here you can see it's basically asking about anti-epileptic drugs mechanism of action. It has here we have a sodium channel. Here we are labeling it as a site A. Here we have something called as SV2A, and we have site B. Here we have GAT1, site C, D, E and F. The question being asked is drug acting on site B and indication of the drug. So B is SV2A. So I have already told you that this is related to anti-epileptic mechanism of action, but in exam you may not be given such hint, so you just have to recall whatever you can recall from the given picture. But here sodium channel, voltage gated sodium channel, GABA, GAT1, glutamate, this all gives you a hint about that this basically is about some anti-epileptic drugs mechanism of action. So SV2A, if you remember, levetiracetam is the anti-epileptic which acts through this SV2A, which is a synaptic vesicle membrane protein, and it helps in release of this glutamate or GABA neurotransmitter in this neuronal junction cleft. Okay, so here drug acting on site B is levetiracetam. Indication of the drug, it is used for partial seizures. Levetiracetam, partial seizure, only this much you are expected to write. Okay. Here again you may be asked about site A also, which is voltage gated sodium channel. Again here you can write lamotrigine, which is the most specific answer, but again valproate can also act through this voltage gated sodium channel because it has multiple mechanism of action. So either of lamotrigine, valproate you can write. GAT1, which is site C, it is for GABA uptake, and this drug which acts through this is tiagabine. Site D is where GABA acts, that is your GABA chloride channel complex. Here the drugs are benzodiazepines, or even valproate also acts through this site. Site E is your potassium channel. So potassium channel, it's showing movement of potassium channel outward, so it is potassium channel opener. So the drugs are your azogabine and retigabine, which opens these potassium channels and acts as anti-epileptic drugs. For site F, it is the site of glutamate receptor. So glutamate receptor, we have drugs like this parampanel, which is a newer class of drug which acts by antagonizing AMPA receptor, which is a type of glutamate receptor. Or felbamate is also glutamate receptor antagonist. Other these you can write. T-type calcium channel, again valproate also acts through this T-type calcium channel, so you can write valproate. So any of the sites can be asked. Like here we are asking about anti-epileptic drugs drugs and their mechanism of action. It can be something related to GABA chloride channel complex, and you may be asked to write down the agonist, antagonist, inverse agonist for that GABA chloride channel complex. So such pictures which are given in your textbook for all, where diagrammatic representation of mechanism of action is given, pay close attention to that, those diagrams. Okay. Another question with the image. You are being shown a biosynthesis pathway of dopamine, and there is a drug A which is blocking some enzyme known as COMT, and drug B which is blocking an enzyme known as decarboxylase, and we have two compartments, peripheral compartment and central compartment. Okay, so we are basically talking about peripheral COM2 inhibitor and peripheral decarboxylase inhibitor. So what is drug A? It's the COMT inhibitors like tolcapone, entacapone, which are, again, obviously this is not being asked, but it can be asked as an add-on question, that like what will be the indication for these drugs. So here we are talking about drugs used in Parkinsonism. Okay, so COMT inhibitors, just write down the names of COMT inhibitors, entacapone, tolcapone, that is sufficient. Peripheral decarboxylase inhibitor, you already know, carbidopa, benzerazide, these are peripheral decarboxylase inhibitor. So this is anti-Parkinsonism drug. Another diagram which is showing some neuronal cleft, some junction between two neuronal membranes. Here we have presynaptic and postsynaptic membrane. It says it's a dopaminergic neuron, and then there are some receptors like A2R, D2, D3R, DAT, D1R, D2R. So these all are basically subtypes of dopamine receptors. It's D2 receptor, D3 receptors. It's dopamine transporter, which is responsible for uptake back into the presynaptic membrane. Here it is postsynaptic D2 receptors. Here again postsynaptic D1 receptor. Okay, and then there is some downstream signaling pathway related to dopamine 2 receptors, which is mediated by CAMP or IP3-DAG pathway. Okay, A2 basically stands for this alpha. It's actually alpha 2 receptor. So what is the question being asked? Name two drugs which acts at site X. Site X is your dopamine 2 receptor. Okay, D2 subtype of dopamine receptor. So D2, you all know what are the D2 antagonists, dopamine D2 receptor antagonists. So these are used as typical antipsychotics as well as antiemetics, and there are some certain other indications as well, like they are used in several other psychiatric illnesses. They are used sometimes as sedative also. So you just need to mention the two drugs which act at site. It can be metoclopramide or domperidone, because we are not being concerned about whether the drug is acting on peripherally or in the central nervous system. So you can write either of metoclopramide, domperidone, or some typical antipsychotic like haloperidol, chlorpromazine, thioridazine. All these are D2 receptor antagonists. So any two of these drugs you can write. Name two extrapyramidal symptoms produced by use of these drugs. Now this is another hint which you can get from questions like these. Like even if you are not able to recall what D2 stands for, if the question is asking about extrapyramidal symptoms, now it should ring a bell in your ears that okay, this must be something related to D2 receptor blockers, because extrapyramidal symptoms are typical of D2 antagonist. So any extrapyramidal symptoms like akathisia, acute dystonia, or drug-induced Parkinsonism, neuroleptic malignant syndrome, anything you can write for these drugs. Here again you can get an additional question like what will be the drug used for management of those extrapyramidal symptoms. So if you are writing akathisia, then you need to write down propranolol can be used for management of akathisia, or drug withdrawal can be tried for relief from extrapyramidal symptoms, or reduction in dose can be tried, or if it's symptoms like acute muscle dystonia are there, then centrally acting anticholinergics are to be used. And okay, so what will be the answer if it would have been asking about the drug acting through site Y, which is your DAT transporter. So since this is the major one major difference between adrenergic or this sympathomimetic and parasympathomimetic neurotransmission. Parasympathotransmission this parasympathomimetic neurotransmission, which involves basically acetylcholine, it gets terminated by metabolism by means of cholinesterase enzyme. That is why in those cases cholinesterase inhibitors and drugs acting by inhibiting cholinesterase or activating cholinesterase, those becomes more important therapeutically. Okay, that's why we study about these organophosphates and other drugs. But in case of these sympathomimetics or this catecholamines, epinephrine, norepinephrine, dopamine, here the major mechanism responsible for termination of action is their reuptake and not the metabolism. Although MAO and COMT are involved in the metabolism, but their major mechanism involved in termination of their action is reuptake, which may be mediated by norepinephrine transporter or DAT transporter or some non-specific neuronal transporter, which are responsible for reuptake of these catecholamines or monoamines back into the presynaptic membrane. So that is why here the more important drugs are the drugs which inhibit these reuptake transporters. So here if the question would have asked about the reuptake inhibitors, you have choice to write any of the answers, like you can write amphetamines or some specific reuptake inhibitors like bupropion you can write, which is specific for norepinephrine and dopamine. So any of these you can write. Okay. Another flow diagram which is related to metabolism of ethyl alcohol or ethanol. Here it is getting converted into acetaldehyde by the action of enzyme X, and then into acetate by the action of enzyme Y, and then into carbon dioxide and water. So the question is asking about identify enzyme Y. So here it is conversion of acetaldehyde into acetate. So it is acetaldehyde dehydrogenase. The enzyme is acetaldehyde dehydrogenase. Drug used for ethanol de-addiction that acts by inhibiting this enzyme. So here the answer would be disulfiram. Answer will not be fomepizole. So fomepizole is basically your alcohol dehydrogenase inhibitor, which acts at enzyme X site, and it is basically used for methanol poisoning. Fomepizole is used in methanol poisoning, which is responsible for conversion of methanol into formaldehyde. Major toxicity of methanol is because of that formaldehyde metabolite. Okay, so that here the enzyme Y will be your aldehyde dehydrogenase, and the drug used for ethanol de-addiction will be disulfiram. You may be asked about drugs having property of inhibiting this enzyme. In that case, you are supposed to write about the drugs showing disulfiram like reactions. You can write metronidazole, you can write chlorpropamide, okay, any drug which comes to your mind, but it is better if you write the more important ones like the metronidazole. Okay. And never confuse this fomepizole with disulfiram. They have a distinct site of action. Another question in the form of match the following. You have look alike, sound alike, 4 drugs. Okay. and in the right side you have these categories. So you have drugs like vernaculant, venlafaxine, varenicline and vinrolabine. Okay, all the drugs resemble each other in their spelling and the way they sound, but they belong to different class of drugs. Like if you remember, vernaculant is a antiarrhythmic drug. It is a potassium channel opener which is specific to atrium and used for atrial fibrillation basically. So it basically increases the refractoriness of atrial fibers, thereby helps in managing atrial fibrillation. So vernaculant is basically your antiarrhythmic. Venlafaxine, this drug you study in antidepressants. Okay, so venlafaxine is a SNRI group of drug, that is, it inhibits serotonin and norepinephrine reuptake, and this differs from TCAs in the form that TCAs have tricyclic structure in their in their structure, but venlafaxine has bicyclic structure, and it is devoid of any other anticholinergic or antihistaminic properties. It's basically a pure norepinephrine and serotonergic reuptake inhibitor, and very little bit of dopamine reuptake inhibition activity. So it is a antidepressant. So venlafaxine is a antidepressant. Varenicline is a anti-smoking drug. Okay, it is a partial agonist of alpha 4 beta 2 nicotinic receptor, and it basically increases dopamine in your reward pathway, thereby decreasing craving for smoking. And in the trials it has been shown it is even better than the nicotine replacement therapy. So varenicline is a anti-smoking drug. Okay, vinrolabine, it is a vinca alkaloid group of drug, and it is used as an anti-cancer drug. Okay, so 4 matches with A, which is anti-cancer. It is used for non-small cell lung cancer and metastatic breast cancer. Okay, so it is vinca group of drugs. Okay, so just remember, try to pay attention to the spelling and how the drugs sounds and what is their spelling. It is useful in questions like this. Some questions from endocrine system, like we have this image in which we are shown picture of a man with the big eyes. So name one endocrine disorder which manifests as shown in this image. So it's basically asking about this exophthalmos condition. Sorry. So it's asking name 2 drugs used for the treatment of this disorder. So exophthalmos can be in the thyrotoxicosis condition. So you are being asked about 2 drugs used for the treatment of this disorder. So you are supposed to write any anti-thyroid drug. You can write propylthiouracil, carbimazole, methimazole. Any of these drugs you can write. Okay. Now again, for thyrotoxicosis, propranolol is also used. Okay, for clinically you can write propranolol also, but here you are supposed to answer name some anti-thyroid drug. Okay, if the question had been like what name drug used for acute management of this condition, so in that case you may write propranolol. Okay. Now you are being shown in an image octreotide ampules. Okay, this is ampule, not vial. So this is a ampule of octreotide. So octreotide is a somatostatin analog, and you are being asked name one endocrine disorder and one non-endocrine disease for which this drug is used. Okay, so octreotide is a very useful drug used in several endocrinal indications like VIPoma, gastrinomas. Okay, even acromegaly it is used. Okay, So any of these indication you can write in endocrine disorder. Carcinoid tumor is also endocrine disorder, will come under endocrine disorder only. And in non-endocrine disorder you can write esophageal variceal bleeding. It is used for that also. So just like that you can write any of those indications. Okay. Now you are being shown. Now here we are talking about some images of these drugs. Sometimes in the spotters you may be given actual physical sample of these drugs. Okay, and you may be asked several questions, any question, theoretical question related to that drug or some part of which you have been taught in your pharmacology lectures. Anything related to that can be asked. Like even you can be asked about I mean it can be anything related to the theoretical part of that drug. Okay. Related to its mechanism of action, the class it belongs, any important drug interaction, any contraindication, any specific adverse effect. So those questions can be asked. Here we are asking about what will happen if you administer a non-selective beta blocker with this drug. Okay, you all know limiprid is a sulfonylurea group of drug which is a oral hypoglycemic drug. So sulfonylureas, as you all know, they increases insulin secretion. Okay, and if you administer a non-selective beta blocker with these drugs, so it with all these sulfonylureas, there is an important side effect which can happen is hypoglycemia. So hypoglycemia, it's important to monitor the patient for hypoglycemia. The patient may give symptoms in the form of sweating or palpitation or weakness or syncope, any symptom patient can have. So when we give beta blocker, many of these symptoms are basically a activation of overactivity of sympathetic system. So when we give beta blockers, these beta blocker may mask these symptoms of hypoglycemia. So except for the sweating part, because it is mediated by sympathetic cholinergic system. So that is why it is advisable not to give non-selective beta blocker with this sulfonylurea group of antidiabetic drugs. Okay. Now you are being shown a strip of OCP, which is oral contraceptive pills, and you are being asked what are its main constituents. So you all know this combined contraceptive pills, they have estrogenic component and progesteronic component. For the constituent part, you can write levonorgestrel, desogestrel, any of these you can write. For progesterone part, you can write levonorgestrel, desogestrel, norethindrone, anything you can write. For estrogenic part, you can write ethinyl estradiol. You may need not to write about the exact dose of these drugs, just mention the name of the constituents. And the second part is a woman on the drug on these drugs forgot to take tablets on 15th, 16th and 17th day. What advice will you give to the woman? So for oral contraceptive pill, it is advised that if a woman has missed 1 dose or 2 doses of this daily contraceptive, then just need to repeat or take an extra dose the next day. But if more than 2 doses are missed, then it is advisable to use alternative method of contraception for the entire remaining cycle, and then from the next cycle, that is 5th day of menstrual flow, from 5th day of that, start this OCP from the beginning. Okay, from the first tablet. So this is how any missed dose of OCP are managed. That is, if only 1 or 2 doses are missed, they just need to take an extra OCP on the next day. But if more than 2 doses are missed, then use some alternative method of contraception. Here you can also get questions like what are the side effects of OCP, what are contraindications for OCP. So these are all related theoretical questions. Okay. Now again, something which we are being taught from maybe 11th class or 12th class: buffalo hump, moon phase, obesity, Okay, purple striae. This is a case of Cushing syndrome or class of drugs. So the class of drugs most commonly associated with the adverse effect profile shown in the figure will be your corticosteroids. Okay, one use for these drugs, so it can be endocrinal use or non-endocrinal use. Endocrinal use like acute adrenal insufficiency or chronic adrenal insufficiency, which is Addison disease, or congenital adrenal hyperplasia, or non-endocrinal uses like it can be bronchial asthma, it can be some rheumatoid arthritis, okay, or anaphylactic shock, or it can be anything. Whatever comes to your mind, you can write it down. Okay, but it should be specific. Okay. Then you are being shown a tablet strip of ibandronet. What is the mechanism of action of the drug shown in the figure? So this belongs to bisphosphonate group of drug. Okay. Although the mechanism of action is not that well understood for bisphosphonate, but it is believed that they acts by inhibiting activity and survival of osteoclast, thereby inhibiting bone resorption. So they are mainly used for osteoporosis. And the second part which is being asked is, why can bisphosphonates be given to a patient at a reduced frequency as less as once a year? So not all the bisphosphonate drugs are given once a year. Only zolendronate is used as once a year bisphosphonate drug. But the thing with these bisphosphonates is that they have a high affinity for calcium phosphate, so they get specifically concentrated in the this bone matrix, and at that side, from that side, they keep on acting on the osteoclast and thereby inhibiting their bone resorptive action. Okay, and thereby they contribute to the anti-resorptive or their role in the management of osteoporosis. Okay, so just need to write down. You just need to answer that they get specifically accumulated in the bone matrix and acts on the osteoclast to inhibit the bone resorption. This much is expected from you. Okay. So this is about ibandronate. Again, you may be asked about what is the side effect with the use of ibandronate. That is, they cause erosive erosive esophagitis they causes, or gastritis they can cause. What special advice you will give to the patient while taking ibandronate? That they, after taking ibandronate, they should not immediately lie down. Okay, this is one important advice which you need to give to prevent esophagitis. Okay, because they are highly they are highly irritant to the esophageal mucosa. Some questions from autocoids and GIT. So this is sumatriptan, belonging to triptan group of drugs. So you all know this is used for migraine treatment. State the mechanism of action of these drugs used to abort an acute attack of migraine. So sumatriptans are a drug of choice for acute migraine. What is the mechanism of action? They act on the 5-HT1B1D receptor. Okay, which they acts as a agonist of these presynaptic 5-HT1B1D receptors. Thereby, again, their mechanism is not that well understood, but they causes vasoconstriction in the dilated cranial blood vessels, which is responsible for the headache of migraine. It has been also postulated they decrease the neurogenic inflammation by decreasing the release of inflammatory cells and cytokines in the neuronal near the neuronal membranes, which is responsible for pain of migraine. But even if you write this much, that they act by acting as an agonist for 1B1D receptor and thereby causing cranial vasoconstriction, thereby relieving the patient from the headache of acute migraine. This much is sufficient. You may be asked contraindication for sumatriptan. So they are contraindicated in all the coronary artery disease patient. Here you are also asked, name 2 drugs used in prophylaxis of migraine. Again, there are multiple categories of drugs which are being used as prophylaxis of migraine. like calcium channel blockers, beta blockers, propranolol, or even anti-epileptics like topiramate, valproate. These are also used for as drugs for prophylaxis of migraine. So any of these you can write. Just remember, drugs for prophylaxis of migraine are different from drugs for acute attack of migraine. Okay? Like NSAIDs and sumatriptan or ergot alkaloids, they are for acute attack of migraine, and these beta blocker, calcium channel blockers, these anti-epileptic drugs, these are for prophylaxis of migraine. Okay? Now you are being shown some phospholipids containing arachidonic acid, free arachidonic acid, prostaglandins, monoxidase, lipoxygenase. So here we are talking about NSAIDs group of drugs, or the drugs having anti-inflammatory properties. You are being also shown COX-1 and COX-2, and the question being asked is name one selective COX-2 inhibitor. So you can write any of celecoxib, rofecoxib, valdecoxib, etoricoxib. Rofecoxib is banned, but you can write celecoxib, etoricoxib, any of those drugs. And what are the group of patients in whom these drugs should be avoided? You all know patients with any cardiac risk or any risk for cardiovascular disease. In those patients, they are to be avoided, because you all know, since they inhibit this COX, so they are selective inhibitor of COX-2 inhibitor, so that thromboxane synthase pathway remains unchecked. So they basically acts as the prothrombotic activity increases in the body. Moreover, they, by inhibiting COX-2, they inhibit also the endothelial PGI2 synthesis, which is PGI2 is your antithrombotic prostaglandin. So thereby they causes procoagulant state in the body. That is why the risk of myocardial infarction and coronary artery disease is more, has been seen in some of these selective COX-2 inhibitor drugs like the rofecoxibs. Okay. Now you are being given this question. A 3-year-old child was brought to the emergency after accidental overdose of paracetamol, acetaminophen, with complaints of blood and vomitus. Lab investigation revealed elevated levels of liver transaminases. So it's been clearly mentioned that it's an accidental overdose of paracetamol. You may be given just a case summary, like patient has ingested this much of paracetamol, and then you may be asked about what is the toxic dose of paracetamol, what is the fatal dose of paracetamol. So the question being asked here is, what is the specific antidote that can be given to this child? So N-acetylcysteine is the specific antidote for paracetamol poisoning. Okay. What other organ is commonly affected after toxic overdose of this drug? So liver is the main organ which is affected. In addition to that, kidney can also be impaired. So you can write kidney, you can write. So just like this, you may be asked about, as I told you, what is the toxic dose, 150 mg per kg for paracetamol. What is dose may not be asked for N-acetylcysteine, but just remember the name of the drug, N-acetylcysteine. Okay. Another question showing an image with arthritis of base of great toe. 50-year-old presented suffering from chronic gout. Name one uric acid synthesis inhibitor that can be used for managing this patient. Here specifically the question being asked is a uric acid synthesis inhibitor. Okay, so the uric acid synthesis inhibitor, you all know allopurinol, which is a purine analog. Okay, and another drug, febuxostate, you can also write. Any of these two drugs you can write. Both are uric acid synthesis inhibitor. Febuxostate, which is a xanthine oxidase inhibitor, or allopurinol. Okay. What medication would you give during an acute attack of gout? Now again, drugs for chronic gout and acute gout are different. For acute gout, NSAIDs are considered more effective. In fact, colchicine is also said to be very effective for management of acute attack of gout, but because of their associated toxicities, they are not the preferred drugs. In fact, NSAIDs are the first line drug for management of acute attack of gout. So here for the B part, you will write NSAIDs, or you can just write diclofenac or ibuprofen, you can write. So that is a sufficient answer for this question. Now you are being shown capsules of omeprazole, which is a proton pump inhibitor. The question being asked is name 2 short-term and long-term adverse effects associated with the use of this drug. So these are used for gastroesophageal reflux disease, gastritis, peptic ulcers. Proton pump inhibitor are used in those conditions. Short-term, so the drugs, since these drugs are very frequently used, so their side effects are equally very important to know and remember. So the short-term adverse effects like loose stools, headache, body ache, myalgia, these are all associated short-term and common side effects with the use of omeprazole. Long-term adverse effects, osteoporosis is one very important long-term adverse effect associated with these drugs. In addition to that, they may also cause gynecomastia, erectile dysfunction on chronic use. So you can write any of these to long-term and to short-term adverse effects. Okay, you may be asked about the mechanism of action of these drugs, anything can be asked. Then you have this ORS powder, ORS packet. What is the osmolarity attained in the final solution of this powder? So the new ORS which is now available, it gives around 245 milliosmol per liter of osmolarity. Just need to write down 245 milliosmol per liter. Supplementation of which micronutrient should be considered in conditions where the substance is used. So especially in pediatric population for diarrhea, ORS is given along with zinc supplementation. So the zinc has some, it increases, it basically protects your mucosal barriers in the intestine. It also increases influx of immune cells in the intestinal mucosa, thereby fighting any offending pathogen in the oral in the intestinal mucosa, and some other immunomodulatory action which are responsible for their role in, especially in the pediatric diarrhea. So zinc supplementation, just need to write down zinc is supplemented as micronutrient along with ORS. This is about the ORS related questions. You may be asked what is super ORS, in which amino acids are supplemented along with this ORS. Okay. The next question is name one antiemetic preferred for use in cancer induced nausea vomiting. So for CIMV, specific drugs are your this H3 antagonists like the ondansetron, palanosatron. These are used for cancer induced nausea vomiting. Other than that, neurokinin 1 receptor antagonist, aprepitant, these can also be used for cancer induced nausea vomiting. For motion sickness specifically, drugs belonging to drugs like promethazine or thiazine, these are more effective for prevention of motion sickness. Okay. So this is about the antiemetic drugs and their indications. So these were some of the questions related to CNS, endocrine and GIT. Just remember, these are some of the representative questions. You may be asked similar questions, but try to focus more upon important drugs and their important characteristics. Most of your questions will be from those only, and the diagrams or the flow charts which has been given in your textbooks, those are more important from the exam point of view. Okay, these questions you can be asked in your spotters, can be asked in your viva also. Okay, so just pay attention to these kind of information while you are going through your revision. If you have any questions, feel free to ask.